Did you know if you have ADHD as an adult and it's not treated, your life might be up to 13 years shorter than if you were treated? Did you know that in the United States, 4 to 5% of adults have ADHD? That's about 8 million people, and only 20% get diagnosed or treated. So that leaves 6.4 million adults out there that might lose 13 years of their normal lifespan. That doesn't have to happen. Hi, I'm Dr. B. Today's video is on adult ADHD, or attention deficit hyperactivity disorder. It's not just for kids anymore. In today's video, I'm going to teach you, what does ADHD in an adult look like? What do we think is happening in our brains with ADHD, and why is it very treatable? And stay until the end to learn even more evidence why, if you feel you may have it, you should get help. So what does ADHD in an adult look like? Well, as an adult, hyperactivity that those kindergarten teachers are dealing with tends to fade away with time because it takes a lot of energy to be that hyperactive, and adult men and women, they can't maintain that level of energy. But impulsivity and the ups and downs of emotions persist. So I might not fidget as an adult, but I might not finish the bathroom remodeling project that I started 6 months ago, and I might bounce from job to job to job after 6 months. So hyperactivity fades, but what persists? Well, procrastination around boring things and being very distractible, especially when dealing with these boring things. And forgetfulness in everyday routine activities like keeping track of your keys, your glasses, remembering appointments and deadlines, and even picking up your kids from their appointments and activities. In addition, an adult with ADHD is often emotionally dysregulated. This means they have a tendency to feel very sensitive to any possible slight from another person. So they might feel crushed for 15 minutes, and then they're better again, and then they feel crushed again. And so sometimes they may actually look bipolar because their emotions are unstable and bounce up and down and do it often. Another common adult symptom for ADHD is trouble sleeping. Now, ADHD, or attention deficit hyperactivity disorder, is a neurodevelopmental disorder. So a person who suffers from that distractibility and that impulsivity was born that way. It's not a behavioral choice. It's not a result of their parenting. It's not a result of any habits that they have grown up with. They came out of the womb with ADHD, and it's been with them 24/7 since. And historically, we used to think that maybe 50 or 60% of kids would outgrow ADHD. Turns out that's just not true. Now it's estimated that 1 out of 7 or 1 out of 8 children truly outgrow the condition. They do learn sufficient coping mechanisms that as an adult, when you look at it, you can't really discover symptoms that are discoverable that would say they have ADHD. But this means 6 or 7 out of 8 continue to have symptoms that are discoverable in adulthood as ADHD. So why does ADHD happen? As I mentioned, our best understanding is that we are born with it, and we think that in certain areas of our brain, we don't have enough of a substance known as dopamine. It's kind of like a vitamin for your nerves. Dopamine helps your nerve cells talk to each other. It's incredibly important in what we call executive function, the ability to organize, motivate, and manage time, as well as managing your emotions. So the most effective treatment is then medications, or a vitamin, so to speak, that will help increase the amount of dopamine in these cells. There are a number of medications available, and the important thing to keep in mind is that you can still be effectively treated if you're a young adult, or if you're over 50 or older, and you've never been diagnosed or treated before. Now, remember, there is good evidence that untreated ADHD can cut up to 13 years off your lifespan, and that 20% of adults are not diagnosed. ADHD is not just for kids anymore. That's adult ADHD. Thanks for watching. If you've enjoyed this video, click on these additional videos on derealization and depersonalization, or this one on psychosis, and please don't forget to hit subscribe.